My name is Dr. Jeffrey Lyman. I'm an orthopedic surgeon specializing in knee surgery, and I live in Coeur d'Alene, Idaho. The decision to have a knee replacement surgery is a major one. There are a lot of reasons to consider knee replacement surgery and a lot of conditions that can get you to the point where you might benefit from that intervention. You can have a variety of conditions that can ultimately lead to degenerative changes in the knee joint. Some of these include trauma, metabolic conditions like gout or pseudo-gout, or even genetic conditions leading to osteoarthritis. There are a variety of approaches to address the symptoms of knee osteoarthritis that should be considered before knee replacement surgery. These are called non-operative treatments. The idea behind a knee resurfacing or knee arthroplasty is that the degenerative parts of the knee joint are removed and replaced with a synthetic implant, which doesn't hurt to walk on. The goal of knee replacement surgery is not only to resurface the joint, but also to largely correct the majority of the mechanical deformities associated with the condition to begin with. In my practice, this accuracy has been achieved by adopting computer navigation as the primary means of producing an accurate result. It's beyond the goals of this video to explain all of the nuances in knee replacement surgery. There's often a significant emotional component to making this decision. The surgery itself often involves a prolonged recovery period and some significant discomfort and medical risks. However, the benefits of the surgery often far outweigh these risks. Most people can expect to have a dramatic improvement in their quality of life and mobility after a knee replacement surgery.
Hi, my name's Chelsea. I'm one of Dr. Lyman's medical assistants. I've worked here for over 3 years. I was born and raised in Coeur d'Alene, and I love going hiking around the beautiful mountains. Prior to surgery, we will have you meet with your primary care provider. At that appointment, they will do a medical clearance, labs within 30 days of surgery, as well as an updated EKG. We will also have you meet with your dentist for a dental clearance prior to surgery. If you have any cardiac issues or pulmonary issues, we will have you meet with your providers to get clearances for that as well. If you're having a partial knee replacement, we will have you complete a CT scan prior to surgery. We ask that patients discontinue the use of any blood thinning medication such as ibuprofen, Aleve, aspirin, or meloxicam. If you are taking warfarin or Eliquis for any heart conditions, we will have you meet with your cardiologist to discuss a bridging program. We also have patients start using Metamucil about 5 days before surgery to help prep the bowels, as constipation can be an issue after surgery. You will either have your surgery at Pleasant View Surgery Center or at Northwest Specialty Hospital. Pleasant View Surgery Center is an outpatient facility. You will be going home the same day of surgery. If you're at Northwest Specialty Hospital, you will stay the night and go home the following day. The facility that you're having surgery at will contact you the day before surgery to let you know what time to arrive at the hospital. Once you have a surgery time, no eating or drinking 8 hours prior to surgery or after midnight if you have an early surgery.
On your date of surgery, you can expect to experience a streamlined and efficient process. You will likely be admitted to the hospital, seen by a nurse, and have an IV placed. Following this, an anesthesia professional will see you and discuss what type of anesthesia you'll have. Most commonly, we use a general anesthetic with or without local blocks for the surgery itself. Of course, I will see you on the date of surgery and address any specific concerns that you might have before surgery. The surgical procedure itself takes approximately 1 hour.
Following surgery, you will be in the recovery room. Nurses will have you on medication therapy, cold therapy, as well as properly elevated. You will have a physical therapist come into the room the day of surgery. They will get you up and walking with the use of a walker. You'll walk about 200 yards with the physical therapist, as well as ambulating stairs. So if you have stairs at home, this should not be an issue. At both facilities, nurses will be monitoring your health levels. Once they feel it is safe for you to return home, you will be discharged with the doctor's consent.
I've found that the recovery from knee replacement surgery is a very individual one. If I were a patient, I would resist the temptation to compare or expect the same results that one of your friends may have experienced after their knee replacement. We found that patients that take a pragmatic approach to experiencing post-operative discomfort do the best. It is normal to expect some pain associated with the recovery process. The healing process demands a lot of what are called polypeptides or amino acids, and these come primarily from proteins that you consume. Therefore, I recommend that almost all patients use some sort of dietary supplement in the form of a protein or high protein diet after surgery. I would also strongly recommend that they have a high protein diet in the week or two prior to surgery as well. Another important feature to the recovery from surgery is to prevent blood clots. Therefore, I'd recommend a steady diet after surgery with respect to foods that contain vitamin K. Lastly, it's critical that you not become dehydrated after surgery. This can increase the propensity of blood to sludge and form blood clots, and also can make you feel very sick and difficult to mobilize.
About 7 to 13 days after surgery, you will have your first follow-up with a provider here in the office. At that appointment, you'll have your first dressing change, as well as we'll follow up with your pain management. At your pre-op, you will get your post-op pain medication script, as well as directions of how to use this correctly once you're home. We will have you take a blood clot prophylaxis to prevent blood clots from forming. We're gonna have patients take aspirin twice a day for 5 weeks after surgery. If you've had a blood clot in the past, please let a provider know this, as we will change your directions after surgery. After surgery, you will have an ACE bandage that will cover your entire leg. Underneath the bandage, you will have a Tegaderm bandage with a foam strip over the surgical incision. This bandage needs to stay in place until your first post-op here at the office. If for any reason there is blood leaking out of your bandage or covering 50% or more of your bandage, please call the office. We will either direct you to Northwest Specialty Hospital or our office in Coeur d'Alene for a sterile bandage change. Following surgery, you will start physical therapy about 3 days after surgery. You will see your physical therapist for 2 to 3 days for up to 12 weeks. We will also see you at 6 weeks after surgery unless there's an incident that happens prior.
My name is Bo Jones. I'm the medical equipment coordinator for Dr. Lyman. I'm here today just to talk about 2 types of machines that we use kind of through the rehab process after total knee replacements. One of the machines that we use is a CPM machine. It stands for continuous passive motion. It's just basically a knee bender. It helps kind of break up scar tissue through the process, and then also move fluid out of the knee, as well as also just increase your range of motion. One of the other types of machines that we use is a Vascutherm machine. It stands for intermittent pneumatic compression device. It removes blood clots from your lower leg. It helps prevent DVTs, and it's also a ice machine, self-contained ice machine. You don't have to add ice to it. It runs on distilled water and isopropyl alcohol.
Because of the variable nature of recovery, and because patients recover at a different rate, it's difficult to say when someone will be quote-unquote fully recovered from their knee. I usually tell them that they can expect to be more mobile and in less pain within 6 weeks of the operation than they were before. It's my belief that you can look forward to a dramatic improvement in your pain and quality of life after this operation. I look forward to being your doctor.
Our team here at OSI is excited to help you along your journey of a knee replacement. We're excited to get you back to the life that you've been missing.